Question: which of the following posture indicate brainstem lesion? Options are A. Decorticate posturing, B. Decerebrate posturing, C. Flaccid posturing, and D. Rigid posturing. The correct answer is option B. Decerebrate posturing. As you see, all these postures are abnormal, pathogenic, okay? But the question is which indicate brainstem lesion. So what is the difference between decorticate and decerebrate posturing? It's very important. It's frequently asked question. So in decorticate posture, there is a severe damage to the brain. That is, there will be a stiffening of the legs. That is, legs will be held out straight and fist will be clenched. Arms bent to hold the hands on the chest. Okay, so in which all the conditions decorticate posturing occurs? There may be a severe traumatic brain injury, bleeding, tumor, stroke, poisoning, infections like encephalitis, and increased ICP. So these are the common conditions in which there will be decorticate posture. Okay, so what is the difference between decorticate and decerebrate posture? In decerebrate posture, arms and legs are straight and rigid, and toes are pointed downward, head is arched backward. Got it? Okay, so arms and legs are straight and rigid. Okay, in decorticate, arms are bent. Here, arms and legs are straight. Okay, so this mainly occurs in brainstem lesion. That is, there may be a damage to the cerebrospinal tract of the brainstem. So, brainstem lesion, decerebrate posture. Brain damage, decorticate posture. That's the basic difference. Okay. Question: area of receptive speech is located in dash. Options: A. Frontal lobe, B. Parietal lobe, C. Temporal lobe, D. Occipital lobe. Correct answer is C. Temporal lobe. So, which is the area of receptive speech? It is Wernicke's area. It is located in temporal lobe. What is the area of language protection? It is Broca's area. Broca's area is located in frontal lobe. Okay, Broca's area is also associated with working memory. Okay, so what happens when there is a damage to Broca's area? There will be problems with speech production. So, there will be productive aphasia. When there is a problem to Wernicke's area, there will be problems in comprehension. That is receptive aphasia. Okay, so two areas of languages, Broca's, Wernicke's. Broca's in frontal, Wernicke's in temporal. Reception of language is by Wernicke's area and production is by Broca's area. Broca's area damage causes productive aphasia and Wernicke's area damage causes receptive aphasia. Hope it is clear. Question: normal volume of CSF. Option A 50 ml, B 100 ml, C 150 ml, D 200 ml. Correct answer is option C 150 ml. Normal volume is 125 to 150 ml. That is around 20 ml per hour is produced. So rate of production is 20 ml per hour. Question: taste perception of anterior 2/3 of tongue is supplied by. Options: A. Facial nerve, B. Trigeminal nerve, C. Vagus nerve, D. Glossopharyngeal nerve. Right answer is option A. Facial nerve. So, about taste of tongue, anterior 2/3 is supplied by chorda tympani nerve. It's a branch of facial nerve. Okay, so anterior 2/3 facial nerve. So, what about posterior 1/3? It is supplied by glossopharyngeal nerve. That is 9th nerve. Okay, so anterior 2/3 facial, posterior 1/3 glossopharyngeal. But anteriorly, the general sensation is by trigeminal. Not the taste, general sensation to anterior 2/3 is by trigeminal nerves. Okay. Which is the most sensitive and earliest indication of increasing ICP? Answers: options: A. Altered level of consciousness, B. Headache, C. Projectile vomiting, D. Widened pulse pressure. All these are indications of increased ICP, but the earliest indication is option A, altered level of consciousness. Question: the most important indicator in Glasgow-Coma scale. Option A, motor response, B, verbal response, C, eye-opening response, D, reflexes. The right answer is option C, eye-opening response. All the three, that is motor response, verbal response, eye-opening, all the three are components of Glasgow-Coma scale, but the most important and the earliest indicator is eye-opening response.